Missing teeth can make life more difficult for a lot of different reasons. If you want to restore just one or a few teeth, dental implants are a permanent solution to replace your missing teeth. Dr. Graves from AOMS joins us today with more on just single tooth replacement. Now, we've talked on the program about a complete replacement. This is just one. Maybe you got it knocked out somehow or just had to get it taken out. There is a solution. You can just replace that one tooth.
Kind of what we're talking about is, let's say you have a bad tooth, that you have a fracture in it, you have to have your tooth removed. You know, we kind of have the technology now where we can take your bad tooth out and place an implant all at the same time. You know, the older way of doing it was you would lose a tooth and then you would have to have a bone graft and the area would heal for a few months and then you go back and place the implant and then let that heal for a few months and finally get your crown. You know, that we have the technology now, we can just kind of do everything in one step and it saves at least 3 or 4 months of you walking around without a tooth.
Right, and you come in, and how long does the procedure normally last? It's just, I mean, you're in and out.
It's a pretty quick procedure. Like, you know, you can be awake for it, or if you're one of those people that want to be asleep to have this stuff done, you could be asleep when you have it done. It takes me somewhere, start to finish, maybe 45 minutes to an hour to do that procedure.
Okay.
Typically, in the recovery on something like this is quick. This isn't something you don't have to miss a week of work for. This is something that we can do the procedure on a Tuesday, and more than likely, you could go to work the very next day.
And so you're not having to deal with a whole lot of pain either.
Minimum. You know, and we talked about now we have these long-acting numbing shots that we give now that keeps everything numb for a few days. So, I mean, really, the pain is minimum. And honestly, if you wanted to be awake to have this done, you could probably have it done in the morning and go to work that same afternoon.
And it's just a titanium post, right?
It's implants is medical grade titanium, yes. But there's two. I mean, we have some that are made of titanium, and then we have some that are non-metal implants. I mean, there's people out there who don't like the idea of having metal in their body, you know, which is fine. And there's an alternative. There's a zirconia implant, which is a non-metal, option that you can have.
Hey, I'm like, the more I can be like Wolverine, the better. I mean, let's just let's crank this up. But this is, it's long lasting. This is in there for the duration.
Oh yeah, I mean, as long as you take care of it, I mean, it should last your entire life. I mean, these things osteointegrate, which means the bone actually fuses to the implant. You know, it looks like a screw, and we screw it in essentially when we place it. Right. But a year later, if I wanted to take that implant out, I wouldn't be able to unscrew it. Your body grows in, it becomes part of your body, and that's what kind of osseointegration means. Yeah. So we would actually have to cut that thing out if we ever wanted to remove, which you probably wouldn't have it removed. But
right. There would be no reason to. So in terms of coming in and getting a consult, because I know we probably got a couple of viewers out there that are saying, hey, this sounds like something I've wanted to do. This has bothered me for a long time. I want to get this done. How do they do it?
You know, you can call the office, schedule a consult, tell them you're interested in implants. And, you know, depending on the situation, sometimes we can do the surgery the same day we do the consult. And, you know, sometimes we want to talk about it and bring you back another time for surgery. You know, it depends on we kind of cater to people, and people's medical conditions vary from person to person.
Yeah, and one of the nice things that you guys also do is you work with the clients, you work it all the way through, and I'm always amazed at the amount of procedures that happen at AOMS. You guys get patients well taken care of. So do me a favor, go check them out when you get an opportunity. It's AmarilloOralSurgery.com, 353-1055. Dr. Graves, always good to catch up with you. So take care. Up next, Chef Bud is back in the kitchen. You may want to